Welcome to the Maternity Mentor. Today we will be talking about things you can do to reduce your risk of having a miscarriage. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Miscarriage is the loss of a pregnancy, fetus, or baby before the 20th week of pregnancy. Unfortunately, miscarriage is very common, with 10 to 15% of all pregnancies ending in miscarriage, most of unknown causes. Mothers and their partners can develop depression and anxiety after experiencing this traumatic event. So let's explore some of the things you can do to reduce your risk of having a miscarriage. Miscarriage prevention can start prior to pregnancy with preconception counseling. Preconception counseling is when you meet with your healthcare provider prior to becoming pregnant to review your medical history and risk factors for miscarriage and pregnancy complications. Your healthcare provider can then create a risk profile to determine points in your medical history that may prove to increase your risk of miscarriage. Your healthcare provider should also order some basic lab work such as blood type, Rh factor, and rubella status, as well as screening you for infections and diseases that may cause pregnancy complications and miscarriage. You may also receive genetic counseling, where your partner will also provide a blood sample. Your healthcare provider can screen you both to determine if you have any genetic risk factors that may increase the chances of having a miscarriage, because 50% of miscarriages are caused by genetic abnormalities. Your healthcare provider should offer you any vaccines you haven't received and review prescribed medications to determine if they are still needed and safe for your pregnancy. Infections during pregnancy are still a leading cause of miscarriage. This can be reduced or eliminated through the proper screening and treatment of infections during your prenatal care. Preventing infections entirely also reduces your risk of miscarriage. There are many viral and bacterial infections that have been associated with miscarriage. Some of these may include toxoplasmosis, rubella, bacterial vaginosis, chlamydia, food poisoning, parvovirus or fifth disease, brucellosis, cytomegalovirus, E. coli, gonorrhea, and varicella, to name a few. In fact, one study showed up to 15% of early miscarriages, which occur prior to 12 weeks of pregnancy, and 66% of late miscarriages, which occur from 12 to 24 weeks of pregnancy, were caused by infection, making it a significant risk factor to address in order to prevent miscarriage. For more information on infections during pregnancy, including UTIs, yeast, and sexually transmitted diseases, please see our videos on these. We will link those in the description below. Obesity is a major risk factor for miscarriage. Studies have shown your risk of miscarriage is 1.2 to 3.5 times higher when you are obese. Being obese is defined as having a body mass index or BMI over 30. You can determine what your BMI is using a free calculator online, or your healthcare provider can assist you with this. In addition to miscarriage, obesity increases your risk of developing sleep apnea, gestational diabetes, high blood pressure, and organ failure during pregnancy. It also increases your risk of needing a cesarean section delivery. Reduction of obesity can occur both before and during pregnancy using diet and exercise. Your healthcare provider can help you develop a plan that is safe for you and will be safe if you are pregnant or should become pregnant. Studies have shown that losing weight correctly during pregnancy does not increase your risk of miscarriage or preterm birth. Additionally, numerous studies have validated that having a healthy BMI has been associated with positive pregnancy outcomes. If you are or do become pregnant while attempting to lose weight, be sure to contact your healthcare provider so they can review your plan and assure it is safe for you and the baby. Extreme dieting and exercise are not safe during pregnancy and should be avoided unless approved and prescribed by a healthcare provider. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about having a healthy lifestyle. Many experts and studies agree that miscarriage can be greatly reduced with a healthy lifestyle, both prior to pregnancy as well as during pregnancy. Healthy habits produce a healthy body, and your body is the home for your growing baby, so you want to ensure it's the healthiest home possible. Make sure you abstain from alcohol and illegal substances prior to becoming pregnant or as soon as you find out that you have become pregnant. Quit smoking cigarettes and marijuana, which have both been linked to issues with brain development in the baby. Eat a healthy diet, well balanced, including plenty of fruits and vegetables. Avoid foods that could make you or your baby ill, including unpasteurized cheeses, raw meat, and meat high in mercury. You should also cut back or eliminate your use of caffeine. Try to reduce stress using mindfulness techniques like meditation and exercise regularly. Every woman of childbearing age should take 400 micrograms of folic acid daily. This helps to prevent neural tube defects in your developing baby. In addition, I usually recommend all women of childbearing age take a prenatal vitamin. Prenatal vitamins contain all the vitamins and minerals a woman should get to maintain good health for herself and her baby. Prior to taking any new vitamin or supplement, you should consult your healthcare provider to ensure it is safe and appropriate for you to take. There are many hazardous chemicals that should be avoided during pregnancy, including formaldehyde, arsenic, benzene, and ethylene oxide. Additionally, excessive lead exposure should be avoided during pregnancy. Lead exposure can happen from being around old paint containing lead and through drinking water that is routed through lead pipes. Make sure to keep your abdomen safe during your pregnancy by wearing a seatbelt every time you are riding in an automobile. Additionally, you should avoid contact sports and skiing while pregnant to prevent injury to your abdomen. X-rays should be avoided unless ruled medically necessary by your healthcare provider. Protection will be provided to shield your baby from the X-ray radiation should you need one. However, mothers should continue to receive dental care, including X-rays during pregnancy, because poor dental hygiene has been linked to adverse outcomes, including miscarriage and preterm birth. For more information on dental care during pregnancy, please see our video on this. We will link that in the description below. Often your healthcare provider will be able to identify risk factors that may cause a miscarriage and will be able to treat them prior to a miscarriage occurring. Incompetent cervix or shortened cervix is a common example of this. This occurs when the cervix is weak and then begins to prematurely dilate during the pregnancy. Your healthcare provider can perform a procedure using epidural anesthesia to insert a stitch or cerclage into the cervix, keeping it closed until the end of your pregnancy. This procedure is usually performed before you reach 12 weeks of your pregnancy, and the stitch is then removed when you reach 37 weeks of your pregnancy unless labor starts sooner. Another identifiable cause of miscarriage is antiphospholipid syndrome. This is also called Hughes syndrome, and it can cause blood clots during pregnancy, which affect placental function, causing miscarriage. It is commonly treated with medications including aspirin and heparin, which has been shown to improve pregnancy outcomes and reduce miscarriages. Miscarriage is one of the greatest fears most women have before and during pregnancy. I hope this has explained some of the things you can do to make yourself as healthy as you can be to reduce your risk of having a miscarriage. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.